Hi, I'm Dr. Susheel Sharma. I'm from Raipur, Chhattisgarh. I'm a joint replacement surgeon and as well as the director of Shri Medishine Hospital, Raipur. Now this era is of Google era. So the patients come prepared with all the questions related to knee and hip surgery and what is their expectation. It's a very precise, very precise. They have very good knowledge of most of the patient. Those who are learned, they have very good knowledge about the implant, about the surface, what kind of the implant he expected, or what kind of the surface he expected from me. And especially for the hip patient, when he come, he expect me for a good range of mobility, pain-free life, and no limb length disparity. This is the most important thing the patient expect from me. And for the knee, the patient expect the full range of the movement, and they come back to their original lifestyle as early as possible, contact sports, and they are like their expectation level is a bit high nowadays because of the too much knowledge about all the procedure and about the metallurgy, about the implants. The basically the old patient, those who are like in the old era, or the patient who underwent surgery long back, and basically they acknowledge this patient, or they are the testimonial for the patient, new generation patient, because the old days the technology skill was not that great. So there are a lot of failure in that era. A lot of patient maybe disabled after the surgery, or their expectancy of the implant is not as great as what we are providing them. So the misconception is what patient think, अभी तो हम चल रहे हैं, we are moving now with some with support of the can or support of the walker, but after surgery probably they would not able to walk as freely as they are before the surgery. So this is total misconception. I have good series of the video which I have operated for the knee or hip, what they were behaving previously before the surgery and what they are behaving after surgery. Very next day of the surgery, or same day of surgery, we mobile our patient. They can back to their all contact sports or their activity within the 2 weeks of the surgery. So to explain patient probably with the video or good set of example is the basic need for to explain them. This surgery is very successful surgery, one of the most successful surgery in orthopedics, and the patient can regain their expectation from the very next day of the surgery.